Hey everyone, I am here with the infamous, my dear friend, Dr. Cheryl Hasib, and we are here at Raise in Houston. I am so proud of you because you are truly raising the bar. This conference has been incredible, and I want you to reiterate your why. Why are you raising the bar? Why are you breaking down those barriers for all of us?
It really comes back, you said it, to the why. My why is inclusiveness, but not only building a network of good injectors, it's providing them with the knowledge, removing those barriers. The biggest thing when I first entered into the aesthetic industry, I didn't have access to the education, the knowledge. Everybody was hoarding, was gatekeeping. I was so disheartened by that I felt we needed to remove that. That's the inception of Raise. Getting some of the leaders in global aesthetics, Jani Van Loghem, Shino Bay, Dr. David Sadaat. These are the creme de la creme. Why not bring them to Houston and allow providers to learn from them, the best of the best, and practice safe? That's the goal.
I can tell you that I have not been able to experience this type of intimate setting that allowed not only for us to see the anatomical landmarks with Dr. Sadaat doing dissection, but also getting to see Jani and Shino doing live demonstrations in conjunction. It was amazing. And I truly appreciate what you're doing, not only from just a inspirational perspective, but like you say what you're going to do and you actually do it. And you're truly an amazing person. So thank you for that.
Thank you. And thank you for being part of my journey.
Yeah.
You are so essential to part of my journey. You being a believer in my why inspires me. It drives me. So then that way I can take it further next year, 2026. We're already talking about it. They're ready for it. They're ready for the next level. And it all comes down to answering your why, being driven for that purpose. And that's what we're here for. And you're part of my journey. They're part of my journey.
We're all connected.
That's exactly right.
Thank you. Thank you, babe. Good. Hey everyone, I am here with the infamous Dr. Jani Van Loghem, and he is from Amsterdam. And the really cool thing about you is, one, that you make everybody feel comfortable and you go out of your way to really teach everybody. As a nurse practitioner, it's nice to have a physician that's actually coming from a country in the world, the only country that recognizes aesthetic medicine as a specialty. Tell me more about your why and your experience with that and what your purpose is here in Houston.
So that's a really magnificent question. So my name is Jani Van Loghem, and I'm an aesthetic physician, KNMG. And the KNMG is an abbreviation for something that doesn't matter, but is a Dutch term. But it means that I'm a officially certified, recognized medical specialist in the field of aesthetic medicine. And currently, the Netherlands is the only country in the world where aesthetic medicine is an officially recognized medical specialty on a governmental level. So next to other medical specialties like dermatology, plastic surgery, there is this specialty of aesthetic medicine. And I was actually the first one who actually was registered as an official aesthetic physician and the first teacher in the field of aesthetic medicine. And I've been working very hard to actually get this specialty registered within the official bodies. And it's been a process of like a lot of politics involved. I had to get all the other specialties involved. And finally, we all agreed that in the end, what's most important is the care that we provide to our patients. So that was the main denominator. And so from that perspective, we agreed that we have to have good education for whoever is going to be treating these patients, right? So we want the patients to be treated in a safe way. So we have to create a curriculum that supplies a way of practitioners to provide really good, safe treatments, evidence-based treatments to their patients. And so that's how it came into existence. And right now, I developed further. So I got my PhD in the field of aesthetic medicine. Optimizing patient safety during facial filler treatments was my dissertation topic. And then I developed further, and now I am serving as an assistant professor at the University of Amsterdam in the field of aesthetic medicine. And my current PhD candidate is Dr. Jantien, who is now doing her dissertation in the field of regenerative aesthetics and how regenerative aesthetic treatments have an effect on skin quality. I am an academic, I am a practitioner, and I have so many insights that I would love to share with my colleagues because, and especially in Houston and in America, where there's a lot of nurses injecting, they're so hungry for knowledge. They really want to take their profession to the next level. They take it seriously because it's their jobs. And they take it so seriously, like any specialist does. If you compare this to a cardiologist, for example, like the way a cardiologist takes a heart attack seriously, that's the way that we as practitioners take the aging appearance seriously. We really want to create the best and safest possible outcomes for our patients. And that's why we really want to learn and develop ourselves in the field of aesthetics. And that's the reason that I'm here in Houston, because I feel that I have a lot to give, I have a lot to share, and the people that are performing the treatments over here, they're very open to receiving all these pearls and all these messages of safety.
I truly appreciate it. Even when I got to see you speak in Niagara Falls, I'm very grateful for that because I do agree that when you are blessed with the knowledge, it's your duty to share it. And what else is it for if we keep it all in and we don't give it to others? And therefore, then you're making a difference in the world. And truly, globally, you really are. You have a great curriculum in the Netherlands. And I actually would, if I could do it all over again, if I could have found you, because it's truly like you go foundational to more advanced to even more advanced. And then you never stop that. And that is where the gap is here in the United States. And maybe globally, you could speak on that more. But I appreciate what you're doing, and I appreciate you taking the time to talk to us and share that. And thank you.
It's really my pleasure, and I think it's our responsibility as practitioners to keep on rethinking what we're doing, right? Because I don't have the idea that I know everything. I always want to find a way where I can do it safer, where I can do it better, where I can create like a more beautiful result. So I'm always curious, and I'm listening to all the speakers at this event, because we had a really amazing event right now today. Houston Rays, it was the speakers that were here. They have so many like pearls of wisdom to share, and I'm always like so eager to incorporate those little pearls into my personal clinical practice.
It's all woven together into this fabric that therefore then just helps everybody. Thank you.
Thank you.
Thank you very much. Everyone, I am here with somebody that I truly call an inspiration and a mentor, Shino Bay, the infamous Shino Bay. Thank you so much for everything that you do in the aesthetic industry, that you do to help educate people, but you also do it in such a different way. You take a part that I think a lot of the aesthetic industry is missing, and that's the spirituality side and how you encompass mind, body, and soul. Tell me more about that.
I can make my patients appear younger. You too, we can all do that. But that doesn't mean that they're gonna stay younger or they're gonna stay young. I think in order to truly have successful aging, there has to be an alignment of mind, body, and spirit, as you said. I try to take advantage every moment that I have a patient in the room to try to give them a spiritual facelift. They're prepared for the latter years to not be afraid of them, to make the best of it, right? We want to add life to the years, no years to the life. We all want to grow old but look young, or grow old but stay young, because youth is an energy, and that's when sometimes you guys see me dancing on stage, and if you're not there, you're going to think I'm a fool. But if you're there and you listen to that lecture, is that our telomeres are social, the community is important for longevity, and that what I do to you will affect you positively or negatively. And that's where spirituality comes into part, because when you're spiritual, you believe that we are one, we share the same space, we share energy. So when I do that, when everybody's dancing and celebrating life with me, life celebrates with us.
Yeah.
And nobody's stressed for those moments. So our telomeres stay long, cortisol levels are low, so that reduces inflammation, because Aging is inflammation at a cellular level. So it is important to harness the energy of youth, but also share it with other people. And that way we can learn to stay young together and teach others to stay young.
I love that because there is a collective conscious. Like we talk about community over competition and how you educate. And I must say, like you have such an easy energy about you. Like you're not intimidating. And I can't even believe that I'm sitting here talking to you, but you make me feel connected to you. And knowing that's how your bedside manner is,